Good morning, good afternoon, good evening, even a good night across Canada. Hi everyone, my name is Barbara Catt and I'm a nurse consultant at Public Health Agency of Canada's Antimicrobial Resistance Task Force. I'm a registered nurse by background and have worked in the field of infection prevention and control, and particularly in long-term care homes for many years. Prior to this project, I was the IPAC lead for all congregate settings in the Scarborough Health Network, and that included 20 long-term care homes. I'd like to take this opportunity to thank you for participating in this project, which is using behavioral science to improve antibiotic prescribing in long-term care homes. I want to start today's presentation with land acknowledgement. We, within the Government of Canada's Public Health Agency of Canada, acknowledge that our work takes place on many traditional and unceded territories of First Nations, Inuit, Métis peoples across Turtle Island, which is also known as Canada. We acknowledge the ancestry connection to these lands, and we respect the richness and importance of cultures, languages, and practices that have taken place here for thousands of years. Let's begin with introducing some not so common terms, or terms that are used interchangeably but not necessarily in the right way. Antimicrobial resistance, abbreviated as AMR, occurs when a microorganism, such as Staphylococcus aureus, no longer responds to methicillin, which is the antibiotic or medicine used to treat this infection. It's also known as MRSA or MRSA. AMR is a growing threat to human and animal health, so much so that the World Health Organization has declared that AMR is one of the top 10 global public health threats facing humanity. And in a recent publication by the Public Health Agency of Canada, AMR is rising in Canada and leading to increased not only illness, deaths, but also healthcare costs. In our long-term care homes, AMR is a resident safety and quality care issue, and we need your help. Your help is through participation in this project using behavioral science to decrease overprescribing. The Public Health Agency of Canada is leading the call to decrease overprescribing of antibiotics in long-term care homes in Canada. This project is co-led with our Behavioral Science Office and the Antimicrobial Resistance Task Force. The Behavioral Science Office provides the expertise in research design as well as the behavioral science lens. The Antimicrobial Resistance Task Force provides subject matter expert. Also, this work is guided by a group of expert stakeholders external to our agency, including nurses and physicians, and these individuals have extensive experience in antimicrobial stewardship, research, and in long-term care homes. Let me describe a bit more on this project, antimicrobial stewardship in long-term care homes. First, what is antimicrobial stewardship? Well, AMS, abbreviated, is a system-wide approach that recognizes the role of residents, prescribers, producers, and the public in an effort to measure and improve how antimicrobials are prescribed by clinicians and used by residents. The goal of this project is to test quality improvement exercises that promote best practices for UTI management. There have been 10 homes that have been selected in 6 provinces across Canada. And what motivated, or what the purpose of the project, was based on a 2018 Canadian study that found 7 out of 10 antibiotics that were prescribed for urinary tract infections in long-term care homes were not needed. And we know that long-term care residents are extremely vulnerable to adverse outcomes linked to unneeded antibiotic use. So what's involved with this project? There's two quality improvement exercises that are going to be used. One is the education for essential care providers. So these could be your friends and families of the residents on best practices for UTI treatment and the ways they can help. And then the second quality improvement exercise is a monthly feedback on your long-term care homes culturing of urines. Healthcare professionals such as yourselves play a key role and partner to help fight antimicrobial resistance. And here's some ways in which you can help fight AMR. Number one, don't use urine dipsticks to diagnose urinary tract infection. Although it may have some value in ruling out a UTI, however, the accuracy is poor, particularly with older adults or your residents, and the harms of using this test in terms of triggering overtreatment definitely outweigh the benefits. More information can be found on this topic, Choosing Wisely Canada. Another way is only to order urine cultures when minimum criteria for UTI diagnosis is present. When we think of minimum criteria, it's painful urination or two or more of the following: fever, new or increased urgency, frequency, pain in the side, lower abdomen, or lower back. These are indications when to collect a urine culture. However, you may have residents who are cognitively impaired and or unable to communicate. So sometimes there may be blood found in their diaper. That too could be an indication for urine to be sent for culture. Another reminder for UTI management. You may have a resident who has had a change from their baseline but does not meet the minimum criteria. So what should be done? Couple of things: assess for alternative explanations like volume depletion or dehydration, skin breakdown, medication side effects, and other sources of infection. Do not order a urine culture, but do order other targeted investigations as needed. So consider also need to encourage the resident to have increased fluid intake, monitoring, and continue with this early reassessment for development of additional signs and symptoms. When a resident has had a change from baseline and meets the criteria, then you should send the urine for culture. It's indicated in the absence of clear alternative explanations and has the presence of minimum criteria for UTI. Also, another way to fight AMR and a consideration is to use the correct methods for urine specimen collection. You can use clean catch, midstream collection, or in and out catheterization. But pay attention to strict aseptic technique is important to ensure the quality of the urine specimen. Lastly, monitor and document. This is really important for the document the resident's symptoms and the clinical status throughout this process. I like this quote from the World Health Organization: "There is no time to wait. Unless the world acts urgently, antimicrobial resistance will have a disastrous impact within a generation." We all have a role to play in antimicrobial stewardship. Thank you for playing your part in helping to decrease overprescribing. Should you have any questions or concerns, please don't hesitate to contact the contact on this slide. Thank you so much, and thank you for participating.